My name is Lynn Markey. I'm here on behalf of the Coalition for the Life Sciences, who partners with the Congressional Biomedical Research Caucus to host our briefings that we have once a month, twice a month, sometimes 3 times a month. And I'm thankful for all of you to come today to hear Dr. Bausell. He is a professor and biostatistician at the University of Maryland School of Medicine. He has written a book called Snake Oil Science, The Truth About Complementary and Alternative Medicine. Obviously, as you can imagine, it has caused a bit of controversy depending on what side of the alternative medicine field you fall on, whether you are one of those folks who stand by the words of the great Mark Twain. There are 3 kinds of lies, damn lies, and statistics, or those who believe, who praise him for his rigorous scientific analysis of the risk and benefits of complementary and alternative medicine. So hopefully after today's conversation, you will have a chance to make up your own mind on where you stand on the issue. And without further ado, I'd like to welcome Dr. Bausell.
Thank you. So the name of the presentation was suggested by my host. It could be called, it was originally called Unconventional Medicine, then Alternative Medicine, Complementary and Alternative Medicine, and now it's Integrative Medicine. And fortunately, this isn't a academic audience, so I don't have to define anything. But so let's just agree that, and I use alternative and complementary alternative medicine, which I call CAM, interchangeably because I haven't quite broken the habit yet. Let's just agree that there are things like acupuncture, herbs, magnet therapy, with one caveat: if they're used for medical purposes to cure a disease or reduce symptoms. For example, yoga can or may not be an alternative therapy. If you use yoga for stretching, for flexibility, for exercise, it's not an alternative medical therapy. If you use it to reduce pain due to osteoarthritis, for example, then it is. Okay. So I guess the first thing we should say is, why do we care about this? At least from a scientific point of view. One is astonishing popularity among both the sick and the worried well. Lynn kept hammering on me to make this presentation brief, so I've cut out a lot of slides, and that was a very compassionate thing that she did for you. So I won't show you those slides, but tens of millions of Americans, and probably a greater percentage in the UK and all over the world, use these therapies. Okay, so another reason I think we should care is NIH spends, and I'll touch on this later, a great deal of money investigating these therapies, as well as trying to integrate them into the medical and other health professions curriculum. And hospitals, this is new, at least this is new to me, are increasingly offering a menu of these therapies to inpatients, not in lieu of their expensive high-tech tests, but in addition to. And as I see it, this just adds yet another layer of expense to our healthcare costs. So based upon my experience, I was once hired to conduct, design, statistically analyze mainly acupuncture placebo-controlled trials based upon that experience, and reviewing and reading hundreds of alternative medicine trials. I began to sort of formulate a hypothesis in my mind, and that was, I began to believe or suspect that alternative therapies were really nothing more than sort of cleverly disguised placebos. So let's start with that possibility. Let's pretend like, and I don't expect or even wish to convince anybody of that, but let's say, what if that were true? This is what really piqued my interest. And what if they aren't effective? How could so many consumers, these tens of millions of people, therapists, MDs, acupuncturists, and scientists, how could they be wrong about something like this? Okay. I mean, and I think the answer to that question is that there's a huge family of artifacts, logical, psychological, biological artifacts that sort of conspire to confound us and make fools of all of us, not just for alternative therapies, but any kind of causal inferences. Inferences, let me back up just a second. I mean, we don't think about it, but we make causal inferences all the time. And I think we're hardwired to make them, and some of them we're very good at, and inferences in which the consequence immediately and inevitably follows our action are pretty easy. And I think our brains are hardwired for those things. If you're an ancient man and you touch an open flame at the campfire, or as a child, if you do that, immediately and always you get a burn. So a logical inference is that the fire caused the burn. But when the consequence doesn't immediately follow the action and doesn't always follow the action, and can be caused by many other things, then, and maybe it's delayed and that sort of thing, then these inferences get much more difficult. And I think possibly that's why we invented science in the first place, is to help us make inferences such as this. So anyway, the type of inference, or the specific inference that I'm interested in right now in this presentation, is someone with knee pain goes to a therapist, and and the therapist sticks thin needles into their body. And let's say that they begin to feel better in a few weeks, a few days, immediately. The inference is, was the reduction of pain due to what the acupuncturist did? And these are difficult inferences to make. And what I say refers both to individuals, to medical practitioners, and to science. We all need to make this type of inference. And if we're interested in acupuncture, we all make it. So let's go over some of these impediments that I've mentioned. Alternative therapies are, they're used for everything, but far and away the most common use for alternative therapies is for chronic diseases whose symptoms sort of wax and wane over time, if you will. Fortunately, we're not in intense pain, like arthritis pain. We're not intense pain all the time, fortunately. And so, just visualize this hypothetical depiction of the natural history of pain. Sometimes it's practically non-existent. Sometimes it's terrible. Sometimes then it goes back down, and this wave keeps repeating itself. So the question is, if somebody were going to an acupuncturist for the first time, when would they most likely go? Would they go here when the pain is very small or light? Would they go here? Probably, most likely, they would go someplace up here when it's extremely high. So let's just view that scenario. And this is what the patient, the scientist, the therapist is confronted with. On first glance, you'd have to be an idiot not to believe that the acupuncture helped you. You took the acupuncture, you got the acupuncture treatment, and your pain went down. So that's one genre, natural history. Another, still natural history, but another possibility is persistent pain. The pain goes along, but a thing certainly I forget, probably most of us, every time we get sick, is that the vast majority of illnesses and symptoms and things that we contract during our life sort of heal themselves. They go away on their own. Some things don't, of course, but many things do. So let's just do this scenario. Look at the scenario. It goes along pretty steadily, and then for some strange reason, it just goes away. The pain goes away. It may go for weeks. Okay. So now let's bring this again into the alternative medical therapy scenario. So let's say that this patient who had this pattern, would have had this pattern, decides that they're going to, they're proactive type. So it's first to go to their physician. Doesn't help. Then they go to their specialist. The physician gets sick of them, send them to a specialist. The specialist can help them, and then they begin to try a wide menu of alternative medical therapies until they hit on, they hit on acupuncture, and suddenly their pain goes away. Now we know that it would have gone away anyway, given my assumption, and you promised to sort of try to put yourself in from my perspective briefly. You will never, ever convince this person that the acupuncture didn't heal them. Okay, so and all these artifacts, and there are just tons of others that I won't bore you with, cognitive dissonance, all kinds of things. But all these things also operate for therapists. One is the failure to keep records, which, most acupuncturists, most complementary and alternative medical therapists, most conventional medical therapists believe that they're actually helping people. But they don't tend to keep records, which means that they selectively remember their successes. And again, don't forget that this also applies to people and scientists. Their patients tend to be polite. And if they're asked, well, did it help you? And you say, sure, I feel better, or whatever. And the natural tendency we all have to confirm rather than to question our ideas. Back to the politeness, physicians or therapists often can keep records, or they don't know, because if they don't help a patient, they don't come back. So, and researchers face all these things, plus the fact that most CAM research employs subjective, self-reported outcomes. In other words, they treat chronic diseases, but the outcomes that they assess, unlike a lot or most of the other types of research the presenters talk about, they use things like self-reported pain. One reason they do so is that's about the only way that you can assess pain is to ask the patient. It's also this type of research, alternative medical research, is very difficult to blind patients. It's difficult actually to blind patients, and by blinding patients I mean in a placebo-controlled trial, you try to keep the patient from knowing whether they're getting the therapy or whether they're not getting the therapy. And it's very difficult to do this, and homeopathy is easy because they take a pill or a substance as water anyway. But something like acupuncture, you can fool some of the patients some of the time, but you can't fool them all. So the blind is always broken for a certain percentage of patients. For some therapies, blinding the therapist is impossible. The acupuncture or chiropractor knows whether or not they're delivering a real or a fake placebo chiropractor. And so To the extent that these things happen, and these things are much easier to control in pharmaceutical research. Let's say a patient figures out, and that they have received a real therapy from a therapist who also knows that he administered a therapist, and then the outcome is a self-report that there's no way of checking whether the patient is telling the truth, being polite, or lying. It makes this type of research very difficult. Not impossible, but difficult. And then there is the most important of all, which is the placebo effect. So I promise not to give you any definitions, but I guess I'll have to. So what is a placebo? This definition I like because it has all the operative words. A pharmacologically inactive substance, water, in the case of homeopathy, or procedure, they can have a therapeutic effect if it's administered to the patient who believes that he or she is receiving effective treatment. The operative word here is belief, believes. If you don't believe that that a therapy can work, then it won't help you. But I mean, who would go to an alternative therapist if they didn't believe that it might help them? Who would volunteer for, say, an acupuncture trial if they did not believe that they had a chance of being helped by this therapy? Another way to look at this, because placebos are very important to my line of thought and work, is that a pharmacologically active substance will work even if the patient is unconscious. An antibiotic will work for an unconscious patient. But an unconscious patient can't have a placebo effect. A placebo effect won't exist for a unconscious patient. And my thesis is that neither will a CAM therapy work for an unconscious patient. So that's the definition. The way a placebo works is the trigger, classic conditioning or learning, really. In some of the classic research, dogs and I guess humans naturally salivate when they get morphine injections. So following several trials, after you can give them a placebo and they'll still salivate. And biologically, the thing that conditioning triggers, at least for pain, are endogenous opioids, which are released by the brain, which are cousins of the poppy seed, which really do reduce pain. So placebos aren't necessarily in your mind. Well, I guess they are in your mind if your brain releases these substances. But you do get very real relief from these things. So, characteristics of a placebo response, just said it has to be learned. It is usually less than the response to the original drug. In fact, say the dog salivates, when it salivates after saline, it salivates less. And this is very important to the whole presentation. Our memories of its effects tend to be exaggerated. Now, this is going to be challenging, both because of your lecturer or talker, and these studies are sometimes sort of hard to follow. But I'm going to try it very hard because I think this is so. I think it's interesting in and of itself, and it's so relevant to CAM alternative research as it is. This is a classic placebo trial. It's been replicated before. It's done by a person that knows a lot more about the placebo effect than I do, Donald Price. And basically, what he did, these are healthy volunteers. Studies like this have been done on patients recovering from surgery, but these are healthy volunteers. So what he did, he said to his patients in his white lab coat, I think he's not a therapist, but he said, I'm going to try out 3 medications. One is a very strong analgesic. Now, of course, we know what he's trying out. He's just trying out a placebo. All these medications are the same as cream. So he puts it on and says, now I'm going to give you a thermal stimulus, which is politically correct. I'm going to burn you a little bit. So with the strong medication, he just burns them a little bit. Because why? Because it's supposed to be. If the medicine is good, it should be a little bit. A weak medicine burns them a little bit more, and then he said, and then I think he called it a wetting substance, which was pretty apt because I think it was just water. And he put that on, and he just, he really applied a lot of heat. So now I hope I said that right. For the weak drug in parentheses, he burned them a little bit more than for the strong one. So then he said, okay, gave them, and of course each person got all three conditions. Then he said, okay, now I'm going to do it again. But this time, and so he puts on the strong medication, and he puts on the weak medication, and he puts on the non-medication. But this time, he burns them, or I shouldn't say burn, he applies the same degree of thermal stimulus in all 3 conditions. Here, remember, he differentially applied heat. And so what people are doing here is rating how much pain they had. So here, the order remains the same, but there shouldn't be really any difference between any of these conditions because they all got the same stimulus. But there was, and it was statistically significant, take my word for it. Then the thing that really fascinated me is right after that, just a few minutes after that, he said, do me one more favor. Remember back when the first time we did this. Can you now rate that pain from your memory? And they did it again. And what was really interesting to me is that the memories of pain under the when this one, let's see, this one is the fake medication. What the patients expected not to have any effect was much greater from their memory than it was a half an hour previously. Okay, so try to keep that in mind. And are there any questions about that? Because, well, that's surprising. So, all right. So let's get to the heart of what I came here to talk to you about. The question is, so what does the best scientific evidence say about the credibility? Credibility being, can you believe the research that's done? The plausibility, can you believe that there's a biological reason for the research to come out the way it did, surrounded the existence of alternative therapies and the placebo effect. Okay, so basically I addressed 4 questions. And obviously we don't have time for all 4, so I'm sure you'll take my word for it, some of these. But is there such a thing as a placebo effect? In other words, could a completely bogus therapy really relieve symptoms? So we've touched on that, but there's a long line of research that shows that yes, there is one. I don't think I have to convince you that there is such a thing as a placebo effect. Is there a plausible biological explanation to explain how placebo could occur? Well, there certainly is, and I didn't really go into the biological research for this, but there really is for analgesics, and probably there are many other. It's just the evidence is so much better for pain. That's what I concentrate on. I mean, I'd be shocked if there's not a placebo effect for depression, for tremors and Parkinson's disease, and there's been a lot of work in that, but I've just concentrated on that. The one I am going to touch on here is there such a thing as a CAM, therapeutic effect, over and above what can be attributed to the placebo effect? Now remember, my thesis, my hypothesis, I didn't say that alternative therapies don't work or that alternative therapies don't relieve pain. They do. My thesis is that they do so because of the placebo effect and because of all these other inferential artifacts. Okay. And the fourth one I'm not going to touch on either much. Is there a plausible biological explanation to explain why a CAM effect should occur if indeed from number 3 we find out that there's plausible, credible evidence that it does. One example of, and the answer is pretty much no. I mean, if you take acupuncture, which I probably will definitely know more about that than the other therapies, there are hundreds, incidentally, of alternative therapies. The traditional mechanism of action is that you put in thin needles to block an energy source called chi, which has never been, physicists have never been able to detect it yet, block its flow or rechannel it along a bodily system of meridians, which nobody has ever found, to sort of correct syndromes like warm, moist kidney deficiency, which I personally don't even believe the Chinese know what it is, but anyway, that's just my opinion. So I'm going to skip that, and number 4. So here are the sources of evidence that I reviewed to try to answer number 3. Can we find credible evidence that some alternative therapies outperform a placebo? High-quality randomized placebo-controlled trials. It has to be placebo-controlled because obviously my thesis only is applicable for if there's a placebo-control group. I freely cede that if you conduct a trial of acupuncture, homeopathy, anything else, and don't have a placebo group, I promise you, if you do the study correctly and cleanly, you will find that therapy works because of this placebo effect. The other source that I looked at are, I now say fairly high quality systematic reviews performed by the Cochrane Collaboration, which is a very unusual organization. If all this fails, I figured we can fall back on a monk from, I think it was the 14th century, who told us that if we fail to find any definitive research, he says, well, then it's called the theory of parsimony, or Occam's razor. I mean, you all know this, that then if you don't have any evidence one way or the other, then take the explanation that requires the fewest unproven assumptions. Think back to my explanation of acupuncture's mechanism. And if William fails us, we can always fall back on an even greater scientific philosopher whose name escapes me right now, but whose dictum applies to two phenomena that always occur under the same circumstances and produce the same results. So, for my high-quality trials, here are the criteria used. I concentrate on the highest impact non-disease specific medical journals. And they happen to be Journal of American Medical Association, New England Journal of Medicine, Annals of Internal Medicine, and Archives of Internal Medicine. Obviously, they've got to, the studies have to employ a placebo control group. Now, and remember, a placebo control group is something that keeps the participant, the volunteer, from realizing whether or not he or she is getting a real alternative therapy or a fake one, a sham one. They had to employ at least 50 subjects in a group, in the two groups. The reason for this is, and I probably should mention this, a thing that outside of clinical trialists probably is unknown in the general public is that the quality of a trial, the methodological quality of a trial, is strongly related to the outcomes. The poorer the quality of the trial, the bigger the results are. Okay? And the better the quality of the trial, the smaller the effects are. And this has been shown many times, many ways. And obtained an attrition rate. Attrition rate means people dropped out of the study. I mean, if a trial winds up, if everybody drops out of a trial or a large proportion, obviously the people that dropped out are probably different than the people who stayed in. So most people would say that these are not that stringent criteria. So, and here are the results. When the trials met all of these quality criteria, these, remember, are our best journals, and really the journals that everybody really aspires to publish in this field. We found one with a positive trial. One was positive. By positive, I mean the therapy was better than the placebo control. And 22 or 90% that showed that there was no difference between the placebo and this trial, incidentally, to the shame, in my opinion, of the editors of the archives of internal medicine, was also funded by, conducted by, and written by employees of the company that marketed it. I think, that's sort of unusual. And I promise, I know I shouldn't do this, but this 4% is sort of interesting, probably just a coincidence, because, when you read in the newspaper about a trial or read a trial yourself, and you hear them say it was statistically significant. Well, this is sort of the definition of statistical significance is a statistician many, many years ago named Sir Ronald Fisher gave us this. It said he defined statistical significance as an event that would occur 5% or less of the time by chance alone. So this is just sort of interesting that 5% of these trials were statistically significant. Then for the ones that failed some of these criteria, the majority of them, 79%, were positive. The chem therapy works, okay, and only 21% said that it didn't, okay. So now I'll try to briefly go through the Cochrane Library of Systematic Reviews. A systematic review, incidentally, is sort of like doing research, only instead of having participants and patients, you have the results of individual trials. You have the subject is a published research article, okay, if you will, or just visualize it as reviews of research, okay, but it's sort of quantitative. They do statistics on it. And so I was much looser with my criteria here. I said, well, I didn't even require that these reviews include placebo control groups, which I probably should have. But I did require they had at least 2 randomized trials, or it's not really a review. One caveat, and I'll let you go, I'll stop with the statistics, is a phenomenon called publication bias, which is sort of a documented fact of life, publishing, I guess, but a documented tendency for journal editors, journal reviewers, and the researchers themselves, evidently, to favor the publication of positive results over negative results. And in a sense, it's just sort of a natural tendency. I mean, it's much more interesting and important, usually, to report this will help you rather than this won't help you. And that's why there's not a lot of interest in my hypothesis, because that's what I'm saying is it won't help you, but at least it won't help you more than a placebo. But anyway, this was published in New England Journal of Medicine, I think in March, by a person named Eric Turner, and I hope this isn't true. This has nothing to do with CAM. He found 74, I think it was, trials registered with the FDA that the FDA determined, well, this is positive, this is negative, okay? And so for the trials that the FDA judged were the pharmaceutical companies, I think these were all pharmaceutical research. The pharmaceutical companies, I mean, the FDA said, okay, the drug works in 38 of these. 97% of them were published later, subsequently published. For the ones the FDA said, no, it's obviously a negative study, only 39% were published. 61% never saw the light of day. You understand from the pharmaceutical company why they wouldn't even bother to publish it. And the thing that I really hate, and I hope is wrong, is that these authors said that 11 of the 14 trials that the FDA rated negative and that got published, 11 of them were published as a positive trial. So, let's hope that that is not true, or I think we're all in trouble. So, but anyway, so here are my results, and I hope you appreciate it because this is very tedious, and I've updated this just for you. When I originally did it, it was 98 reviews, and that was a couple years ago. So these things are continuing to occur. The results, the percentages are just about the same. Now here, I've got a much higher percentage of positive results. And positive I defined, I just took quotes from just the conclusion. Cochrane reviewers have a bottom line conclusion that says it works, it doesn't, whatever, and sometimes not quite that definitive. So 21% of these were positive, okay. Then I applied, and you're perfectly welcome to criticize this because this is a post hoc screening that I stuck on there, but I just said, well, I wonder what happens if I just look at the positive reviews that only had one placebo control group. Remember, this is a review supposed to be multiple studies. 3 dropped out. If they really didn't have credible placebos, 4 dropped out. If they won, glucosamine and chondroitin was sort of trumped by, it was positive, but then they did a huge, NIH funded a huge trial, and something like 500 participants, and it was sort of definitively negative. So, and 9, now this is very chauvinistic, I admit, had no English-speaking confirmation. Now the reason I did that was that there have been other systematic reviews that have mainly looked at acupuncture research, and there are really hundreds of acupuncture trials done. And what these individuals found was that some areas of the world only publish positive acupuncture trials. Asia and Russia are, as I recall, the 2 main culprits. Applying the screen, we get back down to Sir Ronald Fisher's original criteria. So, my conclusion, and this is very unusual conclusion because if any of you ever read clinical trials and things, they always end. But however, this study was the greatest thing since sliced bread. However, more research has indicated, well, maybe sometimes we reach a point where maybe we don't need more research, and that is, anybody here from NIH? Thank God. Maybe for alternative therapies, we've reached that point. Here is just given that some people in this building are interested in money. Here is sort of a history of, that stands for the National Center for Complementary Alternative Medicine. Their appropriations started out very modestly and remained modestly, and then a blip, I forget whether this is the blip, it was upgraded from the office of, it started out as an office of unconventional medicine, and they thought that wasn't very, people sort of snickered at that at NIH. And so they changed it to the Center for Complementary and Alternative Medicine. And this is that huge blip, came up, everybody's having a little level and off at NIH. But you see it's quite dramatic. And once they are upgraded, now I'm in Boulder, and nobody there from that institution. Once they're upgraded probably to the National Institute of Integrative Medicine, it'll probably be another blip. Interestingly, I didn't know this when I did my book, the National Cancer Institute actually spends more money on alternative medicine than this thing. I mean, forget the war on cancer. We're not going to win that one if that gets it. But anyway, here I go. And so there are, many perspectives that you can view this. Here's one, So, all right. So, what's the harm in all this, I guess? So what? I mean, after all, the strange person up here is not saying to you that alternative medical therapies don't work. They do. He's saying they don't work better than a placebo. So what's the harm? These are some of the things that I think just mentioned. We're spending a lot of money doing research, but I don't think any more research is required. Trusted societal institutions such as NIH and our medical schools, in my opinion, should not lend credibility to things that aren't backed by credible scientific evidence. I think people deserve better. I used to be in a book club, and I never read the books, so they didn't kick me out, but I left. And so when I published the book, they invited me back because they figured I'd read that one. And they looked at that. And so one of the people there showed me a newsletter from Harvard. And she said, well, and it was a complementary alternative medical newsletter. And it said, this cures that and this cures that. And she says, it's from Harvard, can't you believe it? And I thought to myself, what an idiot, And then, how naive, I shouldn't say idiot. After I left, I thought, the woman's right. We should be able to believe things like that. And it's just a crime that we can't. But anyway, so also, given this low in credibility I just mentioned, is it any wonder that, if you go to a physician 20 years ago, he'd say, that's nonsense, These things don't work. But in this politically correct world, we don't say that anymore. And is it any wonder when NIH and medical schools are pushing it? Or hospitals now offer inpatients CAM therapies. Another thing is that many CAM therapist claims go far beyond what can be expected of a placebo. They often maintain that these things are powerful cure-alls and can cure cancer. and restore joint cartilage, and they can't. An important thing, I've touted what a neat thing the placebo effect is, but placebos have their limitations. A placebo can't cure anything. Okay? Might make you feel better, might relieve the symptoms temporarily. And it's not morphine. If you break your leg, you need morphine. No placebo is going to help it, because remember, placebos aren't nearly as strong as an active drug. So, and this is just my opinion, but CAM therapies represent products being sold under false pretenses. And some people call this fraud. And finally, just for you guys, science is an expensive and I think important enterprise. So we hardly ever come to Congress and say, let's spend less money. But here's somebody, I think not just me, but I think the evidence that says for this one particular field, why don't we save some money? And with that, I was a little more long-winded than I hoped, but I'll be happy to answer any questions I can.
I'd like to start off, before we get to the question and answers, and clarify for some of the staff people here that even though you're saying no more money for alternative medicine research at the NIH, that doesn't mean we want to take it out of the NIH system, right? Correct? We would rather infuse it back into research programs.
Yeah, I think one of the, maybe, and if that was deleted, that's your fault, because it was one of the slides. But no, I meant to say earlier, and maybe it wasn't there, that why don't we, I believe I did delete that one. Why don't we redirect this money? NIH is sort of hurting. Some of the serious institutes now, they're sort of underfunded, like the rest of the government too. Why don't we sort of redistribute this money to an institute that might actually eventually find a cure for something or effectively manages a symptom? So thank you then for that.
With that, I'll take questions.
I think you raise a bigger issue, particularly with focus on comparative effectiveness and other sorts of things we're looking at, is how many of the current therapies in general, not just CAM therapies, are really placebo?
Well, that's something that I didn't touch. There are a couple answers to that. Both of them, the bottom line is I don't know. But one is that, I just said that, and I don't know if it's true or not, but it's been estimated that 1,000 of these therapies. Obviously, many of them have no trials at all. And the same thing is true with, I don't know that there are many conventional therapies that don't have any trials at all, because the Cochrane Registry of Clinical Trials has hundreds of thousands of clinical trials. But there are many conventional medical therapies that don't have a solid evidence-based result. Then the other thing that says, I don't know, is a thing that I didn't stress is the placebo effect is not the sole property of alternative therapists. Conventional medical practitioners, since Hippocrates, have known about this placebo effect, and it's been part of their arsenal. In fact, some people have said that before the discovery of insulin, antibiotics, and vaccines, well, vaccines are old, but that the average practitioner only had 2 or 3 effective, biologically effective therapies in his bag when he went around, his medicine bag. So anyway, yeah.
I'm from Indonesia, and one of the folk medicine, when you catch a cold, is to rub your back. Have you heard about that? To rub your back with coin or something that it's hard, you know. And then what happens, you use baby oil or whatever, you know, you can use eucalyptus oil or something, and then you rub it. And then I think the blood capillaries sort of get activated. And so the funny thing is, if you really are sick, then you get red. So you rub on your back, on the spine, you know, next to the spine, and then you go sideways. And so you look sort of like a tiger, you know, it's all red. And then you rub it with something that is warm, like eucalyptus oil or something, and you are healed. I mean, I do that all the time, up to now, you know. I have a friend who can do it to me, and I do it to other people, and I get healed. Like, you know, I take Tylenol or aspirin, but sometimes I don't get whole, you know, until I get this background. And I think some medical doctors did some research, and they say, you know, because the blood cells get activated, and it's the white blood cells will think that your body is being attacked, and so they get activated, and that's why you get healed. That's what they say. But I mean, I'm doing it all the time, and it's healing, you know.
My advice to you is keep doing it if it's working for you. But I would be willing to bet a large proportion of my vast fortune that if we did a clinical trial on it and had...
Well, it doesn't need any trials, you know, but...
well, I think, you know, that's true for you. It's not true for scientists. For scientists, we need proof, you know. So...
yeah, and this is not only in Indonesia. I think in Vietnam, in the Asian countries, you know, also in...
I mean, Asia, I mean, I think Germany is the fatherland of complementary alternative medical therapies, but Asia is close behind. So,
Yeah.
yeah. I'm sorry, go ahead.
Yeah, could you repeat the name of your title of your book?
Oh, all right, I'll pay you afterwards. So it's called Snake Oil Science, The Truth About Complementary. It's not my title, just like this one wasn't my title. My titles, nobody ever likes them. But it was originally called Placebo Therapies, but the publisher didn't like that, so that's not sexy enough. One of the reviews said, incidentally, and I'm not trying to sell the book at all, well, actually, but anyway, it said a surprisingly gentle treatment given the title, you know, so anyway.
Yeah, I had two different things. Just you were talking about the difficulty of doing double-blind, single-controlled studies with alternative medicines because of the nature of the different treatments. Does that, in a way, account for the fact that whenever people try to do that, or try to, you know, do different studies, that they're not meeting those standards, meeting the double-blind, placebo-controlled standards, and you know, is that influencing the result? The fact that you can't actually do those kind of studies very easily?
You know, I don't think so, because if I interpret your question correctly, because let's say you do the study and your placebo is very poor and doesn't fool anybody. I don't know whether that's the question, but I mean, in truth, for acupuncture research, if you've had acupuncture, you can feel those little needles in it, and some acupuncture placebo procedures just sort of take the thing on and they pretend to push it down through a guide tube, and they don't get that insertion. But if you think about it, if there's such a thing as a placebo, that would conspire to make the result positive, because the people in the placebo group would figure out very soon that they're not getting anything, that they're getting something fake, because when you sign a form of consent, these days you have to say you may or may not receive, you know, acupuncture. So Now, I may not have answered the question, so you
I mean,
can.
the fact that there's so few studies with truly positive results is that because they weren't able to be done, to the highest standards because of their.
Well, there tend to be, there are a lot, I feel like I'm failing in capturing your question, but there are a lot of studies done now, a lot of alternative, what I presented is just a drop in the ocean of the number of trials. But most of them, far and away the majority of them, don't use placebo controls, and so I didn't consider them. A lot of them are published in, there was a homeopathy systematic review that had 98 studies, and none of them, or practically none of them, would have met my criteria. So I don't know, and that's a shame because homeopathy is one of the few, there shouldn't be any trouble at all. And I mean, even pharmaceutical studies, there are trouble with the placebo. They manufacture a pill that tastes, looks, and smells like the real thing, but I mean, heavy-duty pharmaceuticals have heavy-duty side effects. So blinding is not perfect, even with them. So, sorry. Yeah, maybe we'll talk later. Yes?
I just have a quick question. I know that you're basically focusing on placebo effects on human subject studies, but what would you say regarding studies that are done on cell cultures using compounds that are found in complementary alternative medicine, techniques? Basically when they find there's no human subject that can screw up the result or misinterpret them or whatever,
right.
But they're finding
Actual
scientifically based evidence on the cell cultures.
Well, we found many chemicals that it's probably chemicals that you're talking about, or biological agents that say kill cancer cells in cultures, but that when transformed, I mean, the brief answer is no. I don't review that. I wait till they do a clinical trial to see if it works with people. Okay, and that goes. Most alternative therapy placebo trials don't have that degree of what I call plausibility. Now, hopefully, if it seems to work, they'll then take it to a trial, and the trial will be much more believable because now, breath of fresh air, we have a plausible biological mechanism that's been done. So anyway. Yeah.
I just have two questions. A lot of alternative practitioners say that one of the difficulties with placebos is they employ reactive therapies. For instance, even Western massage is a reactive therapy that, depending on the patient himself and the responses you get from the patient, you change the therapy that you're providing. It's not a static product, whether biological or even a chemical compound would be. And so in those situations, for instance, one of the more famous acupuncture trials, which may have been one of the ones you used, proved that people who were supposed masters of acupuncture and then untrained people who just inserted needles at random, they found no significant difference between the results. And yet, one of the dangers that I think some of the practitioners of acupuncture would say is that the placement of needles is not simply a static act, but one that requires a response from the patient. So in one trial you wouldn't know, in another you would. And so that placebo sort of becomes very confusing because the signals get all mixed up. What do you think of those sorts of concerns from the alternative community?
Well, I think it's just not the alternative community that says that. I think it's not unusual for people to say that science, doesn't work for us. It's not applicable for us. Acupuncture is a good example because these guys are getting very sophisticated in their arguments. There was a trial in the archives just recently in which they had 3 groups: sham, and this was irrelevant placement of needles. placebo needles and conventional care. Well, forget conventional care, because always if you have a conventional care control, the CAM therapy is going to be better because of the placebo effect, because people are going to volunteer for the trial because they want to get the acupuncture. But anyway, so that's what they found. They found both the placebo acupuncture, the real acupuncture, were better than conventional care. And then this is the same journal that let the company-based study get through archives. Then these were, well, they really got creative, and they said, you know, there must be something very special about acupuncture, because it doesn't even make any difference where we place the needles. It still works, you know. Completely forgetting that when they did put in the grant proposal, I'm sure, that the placebo acupuncture was a placebo control group. I mean, that's similar to that other slide. Somebody tries out spent $100 million to develop a new pharmaceutical drug. They develop a very careful placebo that smells, tastes, etc. They try it out. There's no difference between the placebo and the treatment. And then they say to the FDA, well, why can't we market them both? They both work. Because people always improve. Not always. I mean, pancreatic cancer trial doesn't. But I mean, generally with a self-reported symptom, they always improve. All the groups always improve from baseline to the end of treatment. You know, and so they're another thing I love about acupuncturists is now they say, hey, we don't believe in, not everybody, but not the traditional acupuncturists, we don't believe in chi and meridians. We think that that the mechanism of action is classical condition, which reduces endogenous opioids to come to this, that, and other, you know. And there I go back, I wish I could remember that philosopher's name about the quacking duck thing, but, you know, that's the same thing, you know, if it looks and acts like a duck. Well, anyway, so.
Thank you.
Well, thank you all. Thank you all. And,